U.S. fertility rate hits record low. What's causing the decline? CDC data analysis. The fertility rate in the United States has reached an alarming new low, now standing at just 1.6 children per woman, as revealed by the latest data from the Centers for Disease Control and Prevention, CDC. This significant decline is not just a fleeting statistic. It marks a continuation of a downward trend in birth rates that has persisted for nearly 20 years. But what does this really mean for the future of American families? Leslie Root, a researcher at the University of Colorado Boulder who specializes in fertility and population policy, explains that this decline is part of a broader pattern of delayed fertility. Despite the drop in birth rates, she reassures us that the U.S. population continues to grow, with a natural increase of more births than deaths. Historically, the U.S. fertility rate has seen considerable fluctuations. It peaked at 3.5 children per woman in the early 1960s, dipped to 1.7 by 1976, and then saw a brief resurgence to 2.1 in 2007. Lower fertility rates are often observed in wealthier nations, and the current figures suggest that the U.S. is now on par with many of its Western European peers. Several factors contribute to these trends, including economic stability and the rising costs of essential living expenses like housing. Experts highlight how these pressures can create significant stress for families, impacting their mental health and overall readiness to have children. Karen Guzzo, director of the Carolina Population Center at the University of North Carolina, emphasizes that financial worries can deter individuals from starting families, stating, "Worry is not a good moment to have kids." In response to these concerning statistics, some lawmakers have voiced their worries about the declining fertility rates and are urging the government to take a more proactive approach in encouraging family growth. There have been discussions within the administration of former President Donald Trump about revising tax policies to benefit families with children. Trump even went so far as to label himself the fertility president during an event celebrating Women's History Month. However, this administration's actions have also included cuts to social programs that many experts believe are crucial for supporting working families who aspire to have children but are apprehensive about the financial implications. Additionally, funding reductions have impacted medical research focused on fertility treatments. Guzzo points out that the measures being proposed are largely symbolic and unlikely to bring about real change for everyday Americans. This situation raises important questions. What can be done to reverse this trend? Are the proposed solutions sufficient to address the underlying issues? We invite you to share your thoughts in the comments below. Do you agree with the current approaches? Or do you think more radical changes are necessary to support families in America? U.S. fertility crisis, baby bonuses, and IVF? What's really happening in 2024? Baby bonus controversy. U.S. fertility rate hits record low in 2024. Government pushes IVF and cash incentives to reverse trend. Image for representation only. In a startling revelation, the fertility rate in the United States plummeted to an all-time low in 2024, hovering just below 1.6 children per woman, as per the latest data released by the CDC on Thursday. This rate is significantly lower than the replacement level of 2.1, aligning the U.S. with many Western European countries. This marks the culmination of a consistent two-decade decline. As recently as 2007, the U.S. was among the few developed countries with a replacement level fertility rate. However, this changed as more women started postponing childbirth or opting out of parenthood altogether. The Trump administration, alarmed by this downward trend, has taken several steps to counteract it. These measures include an executive order to broaden access to in vitro fertilization and proposals for baby bonuses aimed at encouraging couples to have children. However, demographers remain skeptical. Karen Guzzo, director of the Carolina Population Center, told NBC News, "Birth rates are generally declining for women in most age groups, and that doesn't seem likely to change in the near future." She further explained that people are delaying marriage and often worried about whether they can afford children. But here's where it gets controversial. Despite the low fertility rate, experts assert that there's no need for panic. Leslie Root, a University of Colorado researcher, stated that this is part of an ongoing delay in childbirth. We know that the U.S. population is still growing and we still have a natural increase, more births than deaths, she said. The total number of births in 2024 actually saw a slight increase by about 33,000. However, due to updated census estimates, the overall birth rate still declined. CDC officials reported that the recalculated data showed no real change in birth rates for women in their late 30s and a decrease in rates for those in their 20s and early 30s. And this is the part most people miss. The declining fertility rate doesn't necessarily mean a shrinking population. It's a complex issue influenced by various factors, including delayed childbirth, financial concerns, and changing societal norms. What are your thoughts on this? Do you think the government's proposed measures will be effective in reversing the trend, or is this a natural evolution of society that we should embrace? Why giving birth in the U.S. is financially unbearable, a mom's viral revelation. What if the decision to have a child in America came with a six-figure price tag before you even brought them home? For one new mother, this isn't a hypothetical scenario. It's the reality that she believes is at the heart of why U.S. fertility rates are plummeting to historic lows. Emily Fisher, a 36-year-old from Ohio, recently welcomed twin daughters into the world. But the joy of their arrival was quickly followed by a wave of medical bills that prompted her to share her story on TikTok. In a video that has since captivated over 831,000 viewers, Fisher offers a stunningly personal and financial breakdown of childbirth in the United States, sparking a massive online debate. This conversation comes at a critical time. According to the Centers for Disease Control and Prevention, CDC, the general fertility rate in the U.S. saw a 3% drop in 2023, marking an all-time low. While many theories point to shifting lifestyle preferences, Fisher suggests a much more concrete barrier. Maybe it's because the cost of having a baby in America is over six figures, and that's just to get through the hospital and back home, she proposed in her viral clip. Speaking with Newsweek, Fisher elaborated on this point. She explained that with essential costs like housing, food, and childcare dramatically outpacing wage growth, milestones that were once achievable for previous generations now feel like luxuries. We can't expect people to buy into having kids when the costs of having them are more than it costs to get a college degree, she stated. And this is the part most people find staggering. Fisher's pregnancy with twins required intensive monitoring, culminating in a scheduled C-section and a 4-day hospital stay. The grand total billed to her insurance was an eye-watering $120,527.51, thanks to what she describes as